Hi, I'm April. I'm a level 1 nursing student. I've been assigned to you to follow you today. Do you have time to give SBAR?
Sure. Today we have Shanae O'Connor. She is in room 231. She's a 34-year-old female, full code. She does have allergies to trimethoprim, sulfamethoxazole. She's a patient of Dr. Engelbert's. She came in with a fever of undetermined origin. She does have end-stage renal disease. She was complaining of chills and malaise. She is a type 1 diabetic. She's been having elevated blood glucose with decreased appetite over the past few days and minimal urine output. She has a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She's been undergoing hemodialysis 3 times a week for a year. She's been listed for transplant 6 months ago. She did have a graft infection 3 months ago, which resolved after antibiotics. She has a history of recurrent UTIs. The AB graft is in the left forearm. There's no tenderness or drainage. Skin is intact otherwise. She's alert and ready times 3. No acute distress, just does appear a little uncomfortable. She reports tingling and numbness in her lower legs, and sensation is diminished. She denies any shortness of breath. She did quit smoking 2 years ago. Chest expansion is symmetrical with clear lung sounds. She has tachycardic regular rhythm. S1 and S2 are present. She has slight 1+ non-pitting edema in the lower extremities. 1+ pedal pulses in both feet, and her cap refill is less than 4 seconds. Her abdomen is soft, round, non-tender. Bowel sounds are present times 4. She does report weight gain of 10 pounds over the past few weeks. She doesn't have any pain with her bowel habits. She's on a renal diet, 1,500 milliliters daily fluid restriction. She reports the decreased frequency and volume of urine, and it is more concentrated and darker in color. However, she denies any pain, burning, or difficulty with urination. She will be activity is tolerated. We'll monitor her I's and O's. We need to notify the physician if her temp is greater than 101 or her blood pressure 180 over 100. She's on daily weights, sliding scale insulin with checks before meals and bedtime. Her last vital signs at 7:30, temp was 101.1, 95 heart rate, 96 room air, 138 over 78 blood pressure, and her vitals are checked every 4 hours. Her last ECU check was at 7:30, and that was at 155. Her CBC, CMP, and culture sensitivity are all still pending. Her urinalysis shows increased white blood cells. So she does have the right median vein, and to begin treating her infection, we will start her on Implementum with Cilistatin and sodium chloride today.
Okay. Why specifically is the client receiving this medication, and what action does the medication have on the body?
The client is showing white blood cells in her urinalysis, which shows infection. So we're going to be giving the imipenem as a broad-spectrum bacteriocide until the culture and sensitivity results are back. The imipenem binds to the bacterial cell wall, resulting in cell death, and it's in combination with the cilistatin, which prevents the renal inactivation of the imipenem.
Okay. And when should you question administering this medication? And does the medication have a therapeutic serum level? Which vital signs should be monitored, and what physiological parameters should be monitored when the medication is being administered?
Okay, so we'll question if the patient has any hypersensitivity, also with the renal impairment. If she wasn't having dialysis within the next 48 hours, I'd question giving the imipenem. Also, we'll watch her creatinine. If there is clearance less than 20 milliliters per minute, she would be at risk for increased seizures. We'll monitor all vital signs, but especially temperature, blood pressure, and pain, and of course her heart rate. We'll monitor I's and O's. We'll assess her urine concentration and color. We'll monitor for any signs of anaphylaxis, such as rash or laryngeal edema. And we'll monitor the labs, the BUN, AST, ALT, creatinine, hemoglobin, and hematocrit.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We'll advise the patient to report any signs of superinfection, such as black furry overgrowth on the tongue, vaginal itching or discharge, loose or foul-smelling stools, and of course any signs of allergy. We would have her contact a provider if fever and diarrhea were to occur, especially if the stool would contain any blood, pus, or mucus. and we would advise her not to treat the diarrhea without consulting a physician.
Okay, and what are the side effects and potential adverse reactions?
Seizures, dizziness, hypotension, C. diff associated diarrhea, nausea, vomiting, rash, sweating, phlebitis at the IV site, anaphylaxis, fever.
Okay, and how will you know if the medication is effective?
Once the signs and symptoms of infection resolve, such as lowered white blood cells and decreased temperature.
Okay, thank you.
Awesome. So I'm going to pull my bags. And double checking in more. So we have the Independent. I'm checking the bag for color, clarity, expiration dates. And we have the sodium chloride. And again, checking color, clarity, no holes, and expiration date. So we'll go ahead and.
Okay.
Hi, I'm Andrea. I'm going to be your nurse today.
Hi,
How are you?
I'm good.
Good. What is your full name and date of birth?
Shanana O'Connor, and I'm 34 years old.
Awesome. Double checking the armband.
Okay.
Do you have any allergies?
I do. It's on the armband. It's a toughie.
Mm-hmm.
Trimethoprim, sulfonyl methyl oxal.
Oh, that's pretty good.
Okay.
Okay, so I'm here to administer your antibiotic. Do you know why you're receiving this medication?
I think I may have a possible UTI.
Mm-hmm. Yep, so you're showing signs of infection. There are white blood cells that came back in your urinalysis. So we're going to start you on imipenem. Are you aware of any side effects that you might have by receiving this medication?
I'm aware of some diarrhea, blood in the stools, rash.
Also, if you have any changes in your heartbeat, if it's fast or irregular, if you have any dizziness or confusion, just put on your call light.
Okay.
I also printed out some more information for
Thank you.
If you have any questions, let me know.
Okay.
Okay. You do have the right to refuse this medication. Are you okay with receiving it?
Yes.
Perfect. All right, so I'm going to check the patency of the IV site. Thank you. Clean, clean, clean. So I'm assessing the site. I don't see any swelling or redness. Do you feel any burning with this?
No, it feels fine.
Okay. Awesome. So it's flushing just fine. I'm just going to let that attach.
Okay.
Okay. So double checking again here. We have the right drugs. We have the sodium chloride, 0.9%, normal saline, and the imipenem cilastatin. Checking the right time. We have the right patient, Shanana O'Connor. We have the right route. May I scan your armband, please? tubing. Okay, tubing is primed, assessing for any air bubbles. Good to go. So I hang my bag and I'm just going to go ahead and connect this here. It's still sterile. Okay. And we will hook up.
Hi, my name's Robert Vaquero. I'm a level 1 nursing student. I'm going to be following you around today. Can I have SBAR and your patient, please?
Yes, today we're working with Marta Yarn. She's
Okay,
an
so
80-year-old
we're going to
Hispanic.
channel select guardrail IV fluids. This is the 0.9 normal saline, double checking with the bag and with the MAR. Is it correct? Yes. And we are running this at 38 milliliters per hour. And the volume to be infused, I'm going to set at 950, so my line wouldn't run dry with the 1,000 milliliter bag. Hitting start, making sure my line is open, and waiting for 5 drops.
My name's Ron Burgundy, and I don't know how to put this, but kind of a big deal.
So we'll go ahead and label the tubing.
Hi, my name's Robert Vaquero.
The
I'm a
date,
level 1
time, and
nursing
initials.
student, and I was hoping I could get SBAR and your patient, please.
Hi, Robert. Today we're working with Marta
Okay.
Yarn.
Does that
She's
feel
an
okay?
80-year-old
Yeah, it's fine.
Hispanic female. She's in full code. She has no known allergies to her regular diet, although she's NPO after midnight because she has a room debridement tomorrow. She's 5'5" and weighs 175 pounds. Her vitals, most recent vitals that were 14-15. Her blood pressure is 144/90, pulse 88, temperature 99.1, respiration was 99, and room air pulse ox was 92%. She is alert and oriented. She was admitted from her physician's office with a non-healing pressure sacral ulcer. It's stage 3. We measured it. It's 4x4x1. She's been treated for 3 months, and we've been assisting her as outpatient, but there's no success in that. She does have dry, scaly skin. The skin breakdown
Okay,
started
so
after
we'll
her
go ahead
last
and
hospitalization 6
administer
months
the
ago. She has a
independent.
history of dehydration and pneumonia.
So
It does
again,
have serious
checking the
exudate, but there's no
armband here, Shania
she
O'Connor.
does have slight hearing deficit,
Scanning.
visual acuity with watery eyes. She doesn't have any complaints of headache. She reports no other visual,
Double
nasal,
checking
or
the
throat problems.
independent with
Her
the
motor
MAR.
and sensory extremities are normal, and her reflexes are nonplussed. She has multiple admissions for the dehydration and pneumonia. She's a non-smoker. Her lungs are clear to auscultation in all fields. However, they're diminished at the basis. She has no history of heart disease. She denies chest pain, palpitations, or any shortness of breath. She has sinus rhythm with occasional premature
I'm going to
beat.
go ahead and inspect my
She
bag.
reports a decreased appetite. She consumed about 50% of her dinner. She denies vomiting and nausea. No reported changes in her stool.
Go ahead and
Her
prime
abdomen
my
is soft,
tubing.
non-tender, non-distended. There are bowel sounds in all quadrants. Her fluid intake is 850 milliliters and output is 350. So there is some concern about the
And
amount
it's
of
primed.
output that she's having.
No air bubbles.
She does admit to occasional stress incontinence with nocturia. She denies hematorial or any vaginal bleeding. The doctor has recommended that they could clean the sacral ulcer with saline and cover with a hydrocolloid dressing. Her doctor is Dr. Jolly, and he's ordered a follow-up with the nutritionist and the wound care post-op. So there's a recommendation that she's going to need to increase her protein. She has a right femoral artery IV. It's a 20-gauge IV.
Thank you very much. Why specifically is this client receiving this medication?
She's receiving this medication because she has an infection in the sacral wound. She has E. coli, and so
There we
she's
go.
getting this antibiotic so that we can treat that. So the antibiotic that she's getting, it will
Okay,
disrupt the
so-
protein synthesis, and so hopefully it will help us
Cleaning the
quickly
hub.
cure that stage 3 ulcer.
Okay, what action does the medication have on the body?
Like I said, it disrupts the protein synthesis, so it will help kill the bacteria.
And
Okay,
when should you
so-
question administering this medication?
In a
We're
set of
cautioning
the
any
imipenem,
renal patient,
so
you don't
channel
wanna give it if a
select,
person is allergic to penicillin.
secondary,
And you just want to monitor, the patient
imipenem,
to see if there has
celastatin.
any adverse reactions to
It
it.
is the
vital
500
signs must be
milligrams
monitored?
and 100
Definitely wanna monitor
milliliters.
their heart rate, their blood
Just
pressure,
double
and
checking my
respiration.
bar in the bag.
And which
This is correct,
physiological
yes.
parameters should be monitored when the medication is
Next.
being administered?
And the
Definitely
duration
any
is
changes
over
in their hearing
1
or any
hour.
ringing of the ears. She does have some hearing deficit, so we want to closely monitor that to see if it gets
We'll
any
hit
worse than it
start.
already is.
What
making
interventions
sure
must
that
be
my
taught
line
to the
is
client
open
to ensure the
and
medication is
watching
administered
for
safely
5
in the hospital
drops.
setting?
Well, you don't, you wanna monitor her lab values, and that's something we'll look at closely. We wanna monitor all of her electrolytes, and we'll look at her phosphate.
And then
you want
again,
to,
we would
before
tag
you
the bag,
administer any
with the
medication,
date,
you wanna see if
time,
the
and
patient's
initials
IV
here.
site is patent. You wanna make sure that there's no redness, no swelling, there's, that we can flush it easily. And, just make sure that we monitor that patient very closely throughout the duration of this treatment.
All right, what intervention must be taught for taking this medication safely at home?
Usually this medication is not given IV, and you're not given an IV and taken home. So if the patient is going to have it at home, they will have special instructions
So,
on how to administer it and the signs to look for.
Charting in the MAR
What are
there.
the side effects and the potential adverse reactions?
Okay, the bed is
They're always,
down. You have your
concerned
collate.
about
Do you have any
anaphylaxis
questions for
and
me?
swelling,
I don't think so.
Okay, wonderful.
shortness of
If anything
breath,
comes
things
up,
that would
please press your
impact
collate.
airway or
Okay.
circulation. One of the keys to this medication is looking at the ability to hear any changes in hearing. And so we'll definitely warn the patient about that, and if they have any anything.
How do you know this medication is effective?
If the patient starts showing signs of improvement, and the labs will reflect that the white blood counts are within normal, and that she has less of the bacteria in that affected area.
Okay, thank you.
Were there any
You're welcome.
pertinent pieces of information you
Before we
reviewed
go in, I
before
just want to
administering the
look at,
client's medication?
Everything that we're giving Ms. Yarn.
Yes, I
So she's
reviewed
getting
the 5 rates,
gentamicin.
the
It's
right
gonna be
patient,
running at
dose,
80
time, route,
milligrams
double checked
over
allergies,
100
and made sure that
milliliters
the
for an hour.
bags were
But
Y compatible.
continuously she has
Okay,
running,
and did this information affect your decision to
normosaline
administer the medication?
It
and
just
sodium
allowed me to
chloride
administer the
with
medication
potassium,
appropriately and
and that is
accurately
going
by
to be
confirming that all of the
running at
information
20
was correct.
Okay,
microequivalents
and
per 1,000
did this
milliliters
information
at
affect
125
how you administered the medication?
So we're gonna have to
Just the confirmation of the Y-site compatibility and the patent IV allowed me to hang the bags and administer the infusion.
Okay, well, thank you for answering my questions.
And with me, I have Robert, who's the